Morning's discussion on Seinfeld's The Raincoats. So, observations, where would the group like to start?
I thought it was interesting to see like where George comes from and like how his parents are like exactly like him. And how they're all oblivious.
To what?
Like, to the fact that people might not feel comfortable in their home because they scream every second.
Mm-hmm. How much of George's history, of that family history, do we get in this episode? Because if you cobble all of that together from several episodes, it actually paints a fairly consistent picture, right? So, what do we know about this family? Having only watched this episode, or maybe 2 episodes if you've watched part 2, which was not assigned, but
wasn't.
It
was assigned in the document.
Well, it wasn't. I mean, you should watch 2. You should watch the entire season, really. But your thoughts about this family and why? First of all, what's the clinical term? What's the psychological term used to describe an individual who has those blinders on, right? That they can only see through their own perspective and can't empathize.
Egocentrism.
Yeah. Right. So this family is egocentric, right? When does egocentrism pose a risk? When does it become a problem? So there's 2 answers here.
It's negatively impacting their relationship.
Always, right? Yeah. So it's clinically significant.
When it persists beyond the normal expected age, which is, I want to say, beyond the age of like 5, 6.
Yeah, around that, right?
Yeah.
We got a child psychologist here. Anybody? Nobody's gonna endorse that or confirm that. Doc, no. You're gonna say no. Yeah.
Okay.
Yeah. I mean, again, completely normal when developmentally appropriate. But outside that developmental range or period, yeah, that it's concerning. It's outside of the norm there. It's abnormal. But perhaps not disorder. Disorder will stick to that real strict definition of when it causes clinically significant distress or impairment in self or others. In this case, it might be the family, but it is the family in our case. And if it does progress, and we even see not only Frank and Estelle, but George himself, what does maladaptive egocentrism, if we could just adopt that term, pose a risk for itself?
Maladaptive egocentrism.
So it does go beyond 5 years and causes distress. The story doesn't stop there. As a clinician, what are you concerned about?
Narcissism?
Yeah, personality development, and therefore potential personality disorder. I think we would initially look at cluster B, and the easiest example there is narcissistic personality disorder, because Kohut actually had those stages, the stages of narcissism, right? Where the final stage 4 or 5, you're asking me to go back now, and maybe 4, is pathological narcissism, which is consistent with the actual personality disorder. Right? Which I don't know if any of the Costanzas actually have, right? They're kind of somewhere else in that continuum. Anything else with regard to the Costanzas, George, or others in this episode?
Well, I think the one thing about the family that concerns me most is like when engaging in the term use of maladaptive egocentrism, and we already saw like signs of how their social cues are kind of compromised in terms of them being in a house and screaming at each other and whatnot, and being like, well, like why are these together? I'm uncomfortable, right? We're just talking, pretty much. So I think like as a clinician, like when you see somebody in there, it's like, okay, well, if I don't fix this problem, it's like, what other issues are they going to have when they're only presented with their own ideologies and their own sense of ego in terms of their actions? Because I think that, like, aside from personality, the one thing I would be concerned with is like actual like behavioral concerns and concerns for others that they interact with. Mm-hmm. If it's not about me, then it's not. So like that can be a pretty dangerous.
Yeah.
But-
And in this episode, and absolutely, and certainly in subsequent episodes, that becomes a plot device. That very dynamic becomes comedic for Larry David in subsequent episodes and seasons. Other characters, Seinfeld, the Raincoats.
I think kind of bouncing off of that egocentrism, George also, like with like the Big Brother thing, even though his actions are kind of extremely harmful to the child because he's making promises he can't keep, he's so focused on like his own escape and everything. So.
And again, has no concern, no thought, no consideration for the Seinfelds that he might be asking them to do some things that are out of context or just not culturally sanctioned. Right? Awkward.
So there's just no, like, when they're screaming and they're like, why don't the Seinfelds like want to come over to our house? He says like, I wonder why. Like when they're screaming, like as to say that he's like acknowledging why. But like, I laughed out loud because I was like, oh my, you do the same thing, and he has no like acknowledgement of that, like no self-reflection.
Sometimes it's easier to pick things up in others than it is oneself.
Yeah.
I also think it was pretty kind of like messed up. They were trying so hard to get out of the Big Brother program while participating in the Big Brother program. You could go around and say these things to the little brother, be like, "Yeah, everything's gonna be all right," and then the moment their back is turned, you're like, "Okay, how the hell did we get out of here?" Like I can imagine how that would, like, if the little brother, if he overheard that, like how that would affect him. It's like, wow, so another caretaker wants to take care of me and then wants to get rid of me the first moment they do.
And while it's not necessarily an opposite, on the other side of egocentrism is altruism, right? But again, it's a little bit of the apples and oranges discussion. Egocentrism is a clinical term used to describe that lack of empathy, that is that aspect of ourselves that we need to overcome to begin to develop empathy for others. Altruism is actually a defense mechanism, right? It's the discharged or phenotypic expression of an inner conflict and unconscious conflict in service to others. That's the way the complexity, that friction between what we want to do, that is our id, governed by the pleasure principle, and what we're allowed to do, the superego that itself is governed by the reality principle. That friction is alleviated through the ego's defense, and that defense could be any number of mechanisms, and all at an unconscious level. One might be altruism. So that's what we kind of see in this episode. There's no doubt that 1% chance, I'd never say never here, but there's little chance that George Costanza is going to manifest altruism as a product of that inner conflict. And there's no way he's going through with this Big Brother program. What are some other defense mechanisms that, if not altruism, you would have hoped George could have? Now, again, any answer is really correct because any defense mechanism works. In the short term, is unlikely to be maladaptive. It's the chronic use, especially of a rigid defense, that can get folks into trouble. Right? But that said, for the test, for the shelf exam, what are some other defense mechanisms that were at least originally considered to be mature and adaptive per Valiant? Was it George Valiant? I always get his first name wrong. Maybe George Valiant. None of my psychology students or postdoc fellows are objecting, so maybe it is George. If not altruism, what are some other mature defenses with regard to the original classification?
Humor.
Sorry? Humor, yeah, which is perfect because this is Psyfeld, and we focus on the situational comedy Seinfeld, and the main character of which often uses humor maladaptively, right? That's why Elaine probably broke up with him in the first place. And they continue to have this very interesting relationship. It's because of his maladaptive use of humor. Okay. The other one that comes up on tests all the time is sublimation, which is what? The artistic expression of that inner conflict. So, painting, sculpture, could be one's job, vocation. Other characters. The Raincoat.
I think that I don't know, because I thought it was just such a random detail with Aaron, how he was the quote close talker, and he would like he had no sense of personal space or social cues. So it's like why someone would be a little bit freaked out if you're standing like right there while you're talking to somebody.
And they show Kramer like like I think he like I don't know like touches him slightly, and Kramer like falls backwards into the corner.
There's a couple things going on there. What do we think of Aaron? Where's the parallel in psychiatry? And I know ASD has gotten folks' minds, and while that can be an example, I'm looking for the broader context.
ASD is autism spectrum disorder. Yeah, okay.
Between 70 and 80% of communication is nonverbal, right? And what Aaron does is very consistent with what we as clinicians sometimes do at bedside. And that is, if we are sitting too close to the bed, if we're sitting too far from the bed, if there's other aspects of our nonverbal communication that are sending a specific message to our patients, it doesn't matter what we say, because that 20% is going to be muffled over by our nonverbal communication. And that's exactly what's going on here. The fact that he leans in, misses the social cue, and does what he does non-verbally will override anything he says. And that's why you see the reactions of these people. And again, in another contextual layer, that includes Kramer, who also has difficulty picking up on social cues. And unlike the others with whom Aaron is talking and not talking, Kramer's reaction is very typical Kramer. Final thoughts, the Raincoats.
I almost wonder if there's something to Kramer's like complete just like over dramaticism, because I always think of like attention-seeking behavior, because we talk about that a lot when we're discussing like histrionic, for example, because all he did was get poked and he looks like he got shot with a gun or something like that. So you know. I guess that's just one of the things of Seinfeld is you have one guy who is something a little wrong up here is acting with another person who also has something wrong up here. I guess that's why it just turns into comedy.
Yep.
It's a bunch of weirdos just.
And for Kramer, I think the initial thought might be something along the lines of commanding the room, making sure the attention and the light is shined on him. But there's really never carry through to support that. Like when the attention then does fall on him, notice that it's only the audience that focuses and laughs. The other members in that room, the other characters in that room really don't. So there's really no effect to it. Yeah. And the lack of effect does not result in Kramer one-upping and doing more. So, I think it is an initial impression. It's not one that is really supported if you pay close attention, if you continue to observe this character in those situations.
I also wonder if like the crowd laughing at Kramer's antics, but them not. Like I wonder if that's like how he sees it in his head. Like he does something like that, and then he's like imagining all these people like haha laughing at him, when in reality everybody's just kind of like, okay, Kramer. It's like I wonder if it's like his own little. I don't want to necessarily say delusion because I think that's a little bit extreme, but like his like internal desire to just like be laughed at, control the room, when in reality that's not at all what's happening.
Yeah. Again, I think, and again, if anybody's got a scholarly project that they want to do, going through a random selection of episodes and actually looking, having some rater reliability, and looking at different scenes with different actions, and then seeing either the audience laughter versus the way in which the people in that room react would be a cool scholarly project, and it really might get to the bottom of what is going on, what is reinforcing this behavior, if anything. We're going to end it here. We'll come back at noon to discuss again. Is it Donnie Darko? What are we discussing at noon?
Vanilla,
Vanilla
Sky.
Sky.
Vanilla Sky. That's what I meant. All right. Donnie Darko's for Red Rum. Excuse me, everybody.
We just,
Vanilla Sky. It will be right now. We're going to say that it's still going to be at noon, and we'll have everybody back then. Thank you.